Hey everybody, this is Paul from Ortho Eval Pal. Today I want to talk to you about flexing a knee that is tight, how to optimize your flexion, and give you some tips on what really works for me. So a couple things you need to remember. This is Wayne. Wayne has had a total knee replacement done 4 weeks ago, and actually doing quite well, but he thought, he said he would let me demo on him today, so that would be great. So getting extension is the most important thing you need to do when treating knees. You really need good extension. That will be for another video. Today I want to talk about flexing. So one of the things people do is they take a patient like this when they're trying to passively flex them and push like this. That's all good and dandy and everything, but what happens here is you're actually compressing the posterior femur and tibia together and getting some irritation. The other thing that's happening here is that the hip, which is arthritic with him also because he's had 2 total knees and his hips are arthritic, his hips are starting to bind down and get a pinch here. So one of the things I like to do is get them to lie right down. So I'm going to put the back of your table down. So we kind of take the hip out of the picture. And the way I like to flex knees is like this. I'm going to have you lift that leg right up in the air. I put a little bumper here so I can get my elbow on that. And then I rest the knee on my hand, kind of in the web space. So now what's happening is the joint is being slightly distracted as I flex his knee. And I get a much better response with this, and patients usually report this as being much more comfortable when trying to flex them, and they do much better. And then I have really good control here, and it just opens up that joint while we get the stretch. So that feels all right, doesn't it? Okay.
A little tight on top.
Yeah, which is what we expect, but much better than just taking the knee and bending it together and getting that compression. So that's a little tip that really works well with people who are really stiff and have a hard time gaining their flexion. Take care.